My name is Jeremy. Today we're going to be utilizing ultrasound to identify an abscess. We're going to go over some basics of ultrasound.
We're going to learn how to use it, what structures you need to identify and look out for, and how to perform this procedure safely.
All right, so we turn the ultrasound machine on. Most ultrasound machines have two main settings. You have your gain, which is your contrast. So notice if I turn the dial to the right, it turns up my contrast and I'm increasing my gain. To the right of the screen, we have these little ticks, which represents centimeters. Right now we're at 2.6, and if we want to increase that, we turn the dial to the right. And I'm increasing my depth. Now I take my transducer, which is a linear probe on this machine. This is really good for superficial type of procedures. This is not great for deep space. There's different probes for that. But when identifying an abscess, we're likely going to stay superficial. If the abscess is super deep, we may need to do surgical consult. So notice on my transducer, these are the megahertz that we use. Ultrasound uses sound waves to identify an object. It's not detectable by the human ear. Notice here we have our indicator, and this correlates on the screen with this blue dot. And this blue dot can be switched to different sides based off of the settings. So always pay attention to where your indicator is so you don't get disoriented.
Okay, so we've got some basic understanding of ultrasound. Let's get started with the procedure.
Okay, so I want to use a good amount of jelly. Sometimes when you're doing this over an abscess, the skin can be sensitive, so if you use a lot of gel, you won't have to push very hard. You want to look at the area of interest in two different planes.
You have your short axis and your long axis, depending on what you're looking at. It can also be called the coronal plane or the sagittal plane.
This way and rotating back this way. And on the screen, since this patient doesn't have any abscess, the depth goes from superficial to deep. So the very top of the screen, you have his epidermis and dermis, followed by his subcutaneous tissue, and then his muscles. You don't see any cobblestoning to the skin here, so there's no sign of edema or infection. Further down, we don't see any vessels, except for right there. So you want to identify any vascular structures. Sometimes vascular structures can look like an abscess. So over here you can use the color Doppler and see if you have any vascularity over that area of interest before you start cutting. So this one certainly does, so we would not cut into that area. But here's what a normal ultrasound would look like. And notice that when I rotate, I can see the vessel in a different plane as well.
And this will come in handy when we do a ultrasound guided IV tutorial.
But it's important to rotate your probe so you can get a 360 view of the structure that you're about to encounter, and you can see the full depth of what you're getting into. All right, so when identifying an abscess, you run it over the area of interest here. And we found ourselves a fluid collection. It's a couple centimeters down, and we're kind of spanning throughout the skin here. There's some slight cobblestoning, which you'll see with some cellulitis, followed by fluid collection. You start to see the anechoic structures with some septal areas and some loculations. You span from left to right in a full plane, and you can see this is a pretty extensive abscess. You can rotate your probe and get the full extent in a different plane. And notice this area is compressible. This does cause some pain to the patient. I want to make sure this is not a vessel, so I can switch to color mode and see if it has any vascularity. Notice there's no redness or blue there, so this is not a vascular structure. A lymph node will also present with a circular area and have a stalk in it. This is not an area where a lymph node would be present, so I have a low suspicion that it's a lymph node.
A cyst is also something that you could encounter. Notice how these borders are well circumscribed and thick, and it looks like a very circular sphere. That's more indicative of a cyst versus an abscess.
So this would be a good candidate for bedside drainage. It's not super deep. You know, if this were several more centimeters down, you may want to do a surgical consult, but this is superficial enough where we can access this and drain it at bedside.
All right, so here's a different abscess. Once again, you can see some cobblestoning going on. We've located this fluid collection. It's not as large as the previous abscess we were looking at. You can see the fluid kind of move around there. We're going to put the Doppler on it just to make sure there's no vascular structures. Does not appear to be any vascularity with this fluid collection, so we're going to go ahead and identify it with our needle. I inserted the needle into the abscess cavity so we know the depth and we know where it's at exactly on ultrasound. Ultrasound gives us the benefit of knowing exactly how deep to go, and just to make sure we're going to cut right into that abscess. So I'm just going to retract my needle here. And now we're ready for our blade. If you see on the top of the screen there, the blade is in the abscess cavity, and I'm just going to make a cut. I can see the tip of my blade, so I know I'm not going too deep. And I'm just making that cut across. And notice to the left there, that circular structure is a vascular structure there. So that's exactly why I like using ultrasound, just so I know what I'm doing at all times. But if it's superficial enough, you'd be safe to do it at bedside without using ultrasound. And now you just go ahead and drain your abscess as you normally would. And as a point of clarification, when using our lidocaine and the needle, we're not injecting inside the abscess space. We're just using the needle to locate the location of the abscess, and then we're just going to create a superficial wheal on the surface of the skin. Injecting inside the abscess space just creates more pressure and doesn't work very well. All right, I have a cool bonus tip for you. We have a hand immersed in water, and if your ultrasound probe is waterproof, you'll have to check the manual. You can actually just use water as your jelly and put the ultrasound probe on top of the water. This will be good in case you're looking for, foreign bodies inside the hand, or, a large fluid collection in the hand. As we can see on the ultrasound screen, we can see how much the area lights up. We've got the bones of the fingers with our cross-sectional view there. You can even see the little vessels inside the finger, so it really lights up the hand really well and gives you a good clear view of the hand structures just by using this trick.
Thank you guys for watching. We're going to have more of these instructional videos moving forward.